Okay. Fair enough, more comfortable to record.
Yes. So one of the things that you were asking me was the building back there. That's a J.W. Marriott that initially was a trunk, so it's got the sail shape the same as the one in Dubai, and that's going to be one of the hotels that we're using for a big conference that we're planning. There's a thing called the Federation of Ibero-Latin Plastic Surgeons that involves Spain, Portugal, and all of the Americas, including Brazil, but excepting Canada and the US. So this organization has a scientific meeting every other year, one meeting per year, and then on the other years we have regional meetings. So this year I went to all the regional meetings in Santo Domingo, and in Mexico, and in Guatemala, and Paraguay, and in Brazil, and also in Portugal. But next year we have only one meeting, and it's going to be in Panama. And I'm very proud to say that I'm president of the organizing committee. It's going to be from the 21st to the 24th of April. We're going to have over 1,000 plastic surgeons attend, and we're going to have close to 250 different scientific either talks or panels or instructional courses or pre-conference workshops. It's going to be very busy, and we're full speed ahead on the last 4 months of preparation, and we expect to have everybody here in April 2026.
I remember when I reached out to you, you are not the first conference president I've worked with, recorded with, and man, you are a busy bunch of people.
Yes.
I remember when I reached out to you, I was looking on Instagram, and you were like, I don't know, in Peru or in Uruguay, and then I reached out to you, and you said, you took a bit long to answer, and you said I'm traveling or something like that. And then I reached out the next week, okay, did you take a look or something like that? You were traveling somewhere else.
Yeah, because this big meeting is every other year. And then the odd years, we have all the regional meetings, and the federation is divided into the Iberic Peninsula, so that's Spain and Portugal. Then you have North America, which is Mexico and Central America. And then you have the Bolivar countries, which are Venezuela, Ecuador, Colombia, and Peru. And they have a separate group, and then there's the South cone, which is Brazil, Argentina, Uruguay, Paraguay, and Brazil. And so I have to attend all the regional meetings to invite people and to get speakers, see who's talking about what's interesting, and then invite our speakers. And as I said, we have probably we're going to end up with about 225, 240 different speakers from all over the country and the countries. And then we also have speakers that are not from those countries. We have invited speakers, like we have people from Norway, from Spain, Spain not, but from Spain is part of the group, but from Norway, from Sweden, from France, from England. We're going to have some people from Morocco, and some very interesting countries that are not part of the Federation, but are very good speakers. And some from the US are also coming as attendees because they know the quality of the program and the quality of the speakers from within the society, also from outside of our group.
You are president of the Panamanian Plastic Surgery Society for a while.
That is correct, from 2022 to 2024.
How was that experience?
Well, it was very interesting. I've been in other political positions, and I enjoy it. I enjoy organizing things, and at that time was where we made the decision to compete, to be the host for this meeting in 2026. So we worked 2 years of lobby to prove that we could do the meeting and that we could be successful. And then the competition ended in 2024 when there was a vote, and we won to be the host of the next one, which was in 2026. But it's interesting because in 2010, we also competed and won, and that big federation meeting was done in Panama in 2010. And at that time, I wasn't president of anything. I was just involved with the commercial exhibits. But I like organizing things, and I like seeing big projects get done. So now I'm the head of the program or of the organizing committee, and I have a lot of people that help me put this together, because it's big thing to get logistics of 200 people to give speeches in different languages. We have a big delegation from Russia that we signed an agreement with the Russian Federation of Plastic Surgery. Their president is going to be here, and there's going to be about 6 other professors giving lectures. They can give them in Russian, and we can have them. We're recording. Estamos grabando. We're gonna have the program in a way that you can speak in Russian, and the computer will translate it and put the text in English.
Automatic.
Automatic, yes. And the lectures are officially can be given in Spanish, English, or Portuguese, but we're gonna have the translation including Russian. So you just put on your earplugs and you tune into the channel that you want to listen in. And better than that, we have a huge room where we're going to have 3 different screens going on at the same time. The talks are all silent. So you can be sitting in this room listening in your earpods, screen A, or if you get bored, switch to screen B or screen C, because we're going to have 1,000 people with 3 different screens. And I thought that was going to be crazy when I got presented that was going to be too much. But I actually went to Brazil last month and saw the meeting being done like that. And they had 2 big screens, people in the audience. You could see and switch from one to the other. And there was no problem because you have your earplugs, so you're not listening to anything. And if you take them off, you go and there's a room of 1,000 people and nobody's talking.
I saw that in Brazil as well. This year, I went to a conference like 2 months ago, and there was a room like this. Personally, I didn't like it. The unusual has taken a turn for the surreal. Can you see there are like 3 different podiums there on the presentation floor? That's because they've been having 3 different presentations at the same time. They actually divided this room into 3 rooms without actually dividing it. So you just get some headphones, and depending on whom you want to hear, you put the audio channel, but there's absolutely no division at all. And I hate it. Because I mean, there are two points here. The first one, I personally think you miss a bit of the, I don't know, community sense, because when you are watching a talk, you can just like tap the person near to you and say, hey, did you say that really? Do you agree with that? I don't feel like that. But sometimes when you're in a room like this, it was exactly that, 3 people presenting at the same time. You don't even need if the person decides who is watching the same thing. And the headphones, I have no problem with wearing headphones for like 3 hours. I do it sometimes. But my headphones are like good quality headphones. Sometimes the headphones they put at this place are kind of like disposable ones. So having them on your ears for 3 hours can be a bit painful.
Well, here, the idea is that we have the ones that they provide, which is a headband, with the two, but you can also connect your own.
That's good.
So you can use your cell phone and connect your own, and so you'll have the choice. Because yes, but I thought it was gonna be distracting that I could not listen to the person. But I've also been distracted the other way when people are talking, and they're asking questions right next to me, and then I miss what's being said by the speaker. But here, if I have it in my ears, it's gonna be fantastic.
What's the exact date of the meeting? It's next year, 2026, April?
Yeah, April 21st to April 24th is the big meeting. But the day before, on April 20th, we have all the presidents' meetings. So the presidents of all the countries of the Society or Association of Plastic Surgery are gonna be there for half a day, and we discuss different bylaws that need to be changed, because as the world changes, our bylaws that were written 50 years ago have had to, they get reviewed and updated every 2 years or every 4 years. So we have those that day before the meeting, and we also have 3 different workshops that are gonna be fantastic. We have 8 of the world most renowned plastic surgeons that specialize on nasal surgery that are going to be talking about open surgery, closed surgery, ultrasonic, preservation, structured. So that's an 8-hour course. Then we have another course on rib remodeling, something that was science fiction maybe 10 years ago. Now we have a procedure where with the ultrasound we can insert the needle on the top part of the rib and make a partial cut, and then by wearing a special girdle, change the shape of the rib cage and give someone that did not have a waist, and it's very popular on transgender, because males don't have that waistline, so it's a very good indication for them to produce that. Initially, the procedure, as it evolved, it started by removing some ribs, but that has a bigger, it's a bigger procedure, it has more risk, it's got more recovery time. Then some would fracture the rib and put metal plates to keep it in that place, and now we're at the point of creating a partial cut, what we call a corticotomy, where we cut just the outside of the rib on one half, and then with outside pressure start changing. So we're gonna have a whole course of that, working with pig models. So with the ultrasound, we localize which rib we want to cut and where, and then with this ultrasound needle, we make the actual bone cut. And then we have a third pre-Congress day that's given by a fellow from Brazil, Mauricio Viaro, and it's going to be of muscle anatomy and how to use the ultrasound to inject fat into different muscles, because we have procedures where we can augment the volume of the muscles and in different areas and make the look of a more muscular a body. And that's sort of the fourth dimension of high definition liposuction. But now there's some studies showing that if you inject fat has growth factors and it has stem cells. So if you inject fat and augment that with exercise, you can actually grow muscle into those areas. So it's not like it's a fatty muscle, it's going to be turned into some muscle and some increased muscle function and strength. So it's not like a fake muscle, it's going to be a real muscle. So in order to do that safely, because we're only injecting, we're not making any cuts, we're not looking at the muscle, we make different puncture wounds, and with the guide of the ultrasound, make sure that we're injecting what we want to inject, where we want to inject it. So we have those 3 8-hour courses before the conference starts.
Well, one of the things I was going to ask you, as a former president of the Panamanian Society and as someone who worked in many countries and has contacted many people, are like any trends you see, particularly in Panama in plastic surgery? You just said one, you just said a major one. I had heard about removing ribs. I was not aware about this new technique.
Well, these trends, as I mentioned when we were talking yesterday, these are no longer Panamanian trends or local trends. Someone in Russia started fracturing ribs a few years ago, then someone in Mexico started removing the ribs. Then immediately someone in Colombia started fracturing and putting the ribs with the metal plate. And then in Peru, someone modified it by making an external cut. And then how you make the cut was then remodified by someone in Brazil. So this has become global. And we have Zoom teachings and webinars every day that you can go. So something that was initially started in Russia, let's say 5-6 years ago, now it's done all over the world, and everybody has access in the medical community to get certified to do this procedure and to learn how to do it safely.
But aren't there like differences in beauty standards?
Oh, yes, of
For
course,
example, when you
of
say
course.
about a nose job, for example, wouldn't you expect different things perhaps from different countries?
Well, it's not only the country, I think it's ethnicity, because I would not expect a white person with very thin tissues to have a black nose. And I would not like, that would not look good. And on a black person to have this little pointy tissues, or someone that has let's say a Persian nose, to make it look into a Caucasian nose. That is ridiculous. And that is something that sometimes it takes some people, patients and doctors, difficulty understanding. But we can make a black nose prettier, a Caucasian nose prettier, or a Persian or a mestizo nose prettier, but you shouldn't try to make a black person's nose look Caucasian. And when you do that and you push it to extremes, we know of a very well-known singer who had that, and he had too many surgeries trying to make it look Caucasian, and it ended up in disasters, because not only it looks bad, but you can start having troubles with difficulty in breathing and forgetting that the nose not only has to look good, but it has to work. And to work, you need to be able to breathe. So trends do happen, but I think it's more cultural. In some countries, they like big breasts. Some others don't like big breasts. Some like huge breasts and huge buttocks. And I think that's a distortion of beauty. To me, that's not beautiful, but I think there's some patients that have bad taste, and some doctors that are accomplices because they like that too. I respect it, but I don't like it. And most of the people that come to me don't like it. The same way with facelifts. If you pull too much, the people look like they're in a wind tunnel, and that is not, for me, that's not beauty. I mean, if you're going to do something, you need to restore the natural curves and shadows and points of where the light shines in order to make something that looks natural. And I think that's one of the things that I worked very hard, and it took me some time to learn how to do that. And many of my patients come because they say, oh, I saw my friend who you did a facelift and she looks good. You can't tell that she had surgery. You just know she looks good. And of course, if you knew her before, you say, wow, that's a good change. It's a big change. But the idea is that you walk into a room and nobody can tell that you had surgery. You just look good.
Buenos dias. Today we are here at Dr. Luis Picard-Ami's clinic. So let's get to see it. Yesterday we talked down there, close to the food court there in the main business center there. I'm not sure how they call it. It's a kind of a mall. Let's take a look here today.